Hello and welcome to When Docs Talk. We're so excited to be back with you all today. For those of you who joined us last week and in the past, you know that we are When Docs Talk. We're a collaboration of emergency, family medicine, and mostly acute care and emergent providers, doctors, nurses, nurse practitioners, PAs. We welcome all. But I want to start off by saying, if you are familiar with us, you've seen us before, I'd like you to remember to go to our webpage, like, share, subscribe. We are on YouTube, we're on Facebook, and on Instagram. We love to get your subscriptions and your participation so that you can always know what's going on with us. But speaking about us, some of you don't know us, so let's start out. I want to let you know that I am Dr. Adidiang Ipe Apo. You can call me Dr. Didi, that's fine too. And I am an emergency physician based here in Atlanta, Georgia, born and raised in Miami, Florida, by way of Nigerian parents. I consider myself a citizen of the world. I am a proud wife and mother of 3, and I'm so excited to have you all back today. I have the rest of my crew. They're going to tell you about themselves too.
Hey, my name is Morgan. I hail from Brooklyn, New York. I am a nurse here in Atlanta, and I take so much pride in being a part of When Docs Talk, and I'm so glad to be back and hope that we have a wonderful show this evening.
Yes, hi, I am Dr. Sonia Penson. I am a family medicine physician trained working in a emergency room urgent care center here in Atlanta, Georgia. I am originally born and raised from Georgia Peach. Was kind of away for a while, did a stint in the Navy, but had to come back with Georgia on my mind.
All right, then.
Hey guys, I'm Dr. Yuli Harrison Lloyd. I am a board certified family medicine physician working urgent care setting here in Atlanta. I am a New Orleans girl, and I've also got some roots in Arkansas. Really happy to be a part of this whole broadcast, and I hope you guys get some good information and enjoy the show today.
All right. So just a little bit about what we're talking about. We are talking about the COVID-19 vaccine. This is something that I know is on your minds. We had over 600 participants fill out a survey for us, and we know it's something that you have a lot of questions about. We've had a lot of wonderful questions since our last show, and I know you've come back with more, and we will try to get to every single one during this show. But we've divided this segment into 2 parts. We call it the facts and the fallout. Last week, we talked a lot about how the vaccine works and different really technical aspects about it. Today, we're going to talk about the fallout because, as you all know, there's a lot of controversy surrounding this vaccine. It's not clear why, but I think anytime there's a new technology, a new medication, and so much that's tied into it politically and otherwise, there's always going to be a lot of controversy, a lot of things that concern people, and we want to get to the root of that and talk about that today in the Fallout episode. But of course, we'll also bring some more facts, so please, if you have questions specifically about the vaccine, keep them in mind, and there'll be a section for you to ask at all times. Bring them on, okay? All questions. Let's tell you a little bit about what's going on with coronavirus right now.
Roughly 104 million cases worldwide as of today, and over 2.2 million deaths. Over 26 million cases in the United States, and over 450,000 deaths. That is ridiculous.
It is. It's really astonishing. I do have some silver linings. We have a little bit of good news. In the past week, actually almost 2 weeks, the numbers for coronavirus have been decreasing, meaning that hospitalizations and deaths from coronavirus have been going down. But I don't want everybody to get too comfortable, okay? I want to show you a little something and make a little plea. So if you look at this over here, the New York Times posted this graph, and it tells us a little bit about coronavirus cases following the holidays. So we know that every holiday in the past, say, 6 months that we've had, we've noticed a spike in cases, a surge, if you will, not just in cases, but also hospitalizations, because there is an argument that just because you're sick or test positive for coronavirus, you might not be that sick with it. However, this also includes some hospitalization data. And I just put this to say that if you look and see every time there's a holiday, we see the numbers go up. Now, we know why this is. We know you love your families. We know you love your friends. We all do. And we want to congregate because that's natural for us. It's natural for us to want to get together with friends and family. But what we're pleading for you this Super Bowl Sunday is that you really be mindful of gathering. We always recommend that you stay within your bubble. So if you don't live with somebody, really congregating in groups is not a good idea. We don't want to see another spike. I don't want to come back a couple months from now or weeks from now with a new graph showing that after Super Bowl Sunday, we went up. So please be mindful of that and root for whatever team you like. I know who I'm rooting for, but be safe this weekend. We got a quiz. Morgan, you want to take our viewers through this?
Absolutely. Which of these symptoms are found in long haulers? A, fatigue. B, headache. C, loss of smell or taste. D, shortness of breath. Or E, all of the above. Come on, guys, give me some answers.
Let's see if we got some answers. Any answers coming up on the board? I see a couple. I see B. I see. Okay, let's see. Let's just tell them. I know they all know. So actually, all of the above, right?
Right.
Yep. We got one that was D. Okay. So we're going to talk a little bit about what this long COVID is, because I'm sure you've heard the term and you might be wondering, what exactly are we talking about when we see or say long COVID? Florence Jones, you got it. E, all of the above. So before we talk about long COVID, I just want us to talk a little bit about some figures, because you all were so vocal about your beliefs. It was an anonymous survey that we sent out, and you let us know exactly what's going on. Last week, we talked about some of the things that you all selected, like whether you're scared of coronavirus, whether you're scared of the vaccine, and the top reasons that you had concerns about the vaccine. This week, we want to talk a little bit about whether you've been exposed to coronavirus. Sonia, do you want to take us through our polls?
Sure. Yes. So one of the questions we asked was, have you had COVID-19? And so the majority of people said no. So quite a few people have had it, but the majority of people who answered the survey hadn't said no, they did not have COVID.
Okay. And I just want to remind those of you who were with us last week that the vast majority of people who had not taken the vaccine in our survey said they were interested in taking the vaccine. So this is interesting to know how many of those people didn't have coronavirus, and it seems like a lot of them haven't had it yet.
So if you had COVID-19 over 1 month ago, are you still having any symptoms? So out of the people, I guess, that had said yes, they had COVID, once again, the majority of people were actually not having any symptoms. They were doing okay. As say, there was still a good bit, or 20% of the people that said yes.
Right. So when they had coronavirus, they may have had symptoms, but we're talking about people who have had it for more than a month, because we're going to launch into talking about long COVID and what that looks like. And it looks like long COVID or prolonged symptoms of COVID are not that common, according to that. So what about the last one?
And are you aware of the long-term effects of COVID-19? So do people really know that, okay, yeah, I get the COVID-19 infection. Can I have some long-term effects from it? And it's not going to go away. And so 73% actually said yes. So the majority actually are aware of that. And 26 said no.
Okay. So it looks like a lot of our people know about long COVID. Obon Jones just tested positive for COVID today. So sorry to hear that. I wish you the best.
I'm so sorry, my friend.
Yeah. Well, let's talk about long COVID, because we did talk about it a little bit last week. We wanted to make our viewers aware of what this phenomenon is. So when we talk about long COVID, also known as the COVID long haulers, what we're really talking about are people who are still having symptoms of coronavirus disease at least 4 to 12 weeks after the start of their acute or initial symptoms. Typically, we put them in this group when they have a negative test now. So they tested positive before, they had their initial symptoms, and more than a month later, they now have a negative test, but continue to have symptoms of coronavirus. It occurs in about 10% of COVID patients, although we're still doing a lot of research. This is a new disease and this is a new phenomenon. And it can occur whether or not you've had severe disease or you had mild disease. So if you were hospitalized with COVID, you could still be somebody who has this long COVID syndrome. Or if you just had mild COVID, you might still be a long hauler in the end. So the symptoms that the people have with long COVID include things like fatigue, shortness of breath, cough, joint pain, chest pain, palpitations where you feel your heart beating fast or hard, hair loss, brain fog, you just don't have the same concentration or memory, depression, headache, muscle aches, fevers intermittently, smell and taste problems. And then we also have some people who experience the severe symptoms, things like inflammation of the heart muscle, which can even result in a bit of fluid around the heart, problems with lung function or kidney function. So those are the severe, less common complications of long COVID, but there's still things to consider. And there's still things that some of our viewers and guests have experienced. I want to now transition because we talk so much about long COVID and you hear the facts and figures and so forth, but I think it's really important. And Sonia, I see you here. I know you're going to share your story too. I think it's important for our viewers to hear stories of people who have gone through this and who are still going through this. And that's what our next segment is going to be. We're going to talk to survivors of COVID-19, of which our Dr. Penson is. And we're going to talk about what they're still experiencing now, because many of them are still having symptoms. But I want to get to the introductions. We have two guests that had a pre-recorded interview. We have Dr. Amarachi Osisanya. She is an emergency physician based in Atlanta, a wife and a mother of 3 young children. She shares that she's trying to find and maintain her peace and sanity in all of it through the COVID craziness. Ms. Jennifer Grant is a registered nurse who works in the emergency department as an RN, a charge nurse, and a flow coordinator. She's also worked as a house supervisor and utilization review nurse. She hails from Cleveland, Ohio, C-Town, and is proud of her 3 amazing children. And she tells WDT that every area that she's been in has taught her so much and that she honestly loves being a nurse. I have 2 other guests who we're fortunate enough to have in our studio audience. One is Mr. Michael Crowley. He is a native of Atlanta. He has had 10 years of emergency and critical nursing experience, both here in the United States and in Europe. Michael, welcome.
Hello, thank you.
Hi, Michael.
Hello, hey.
We're also joined by Veronica Blackshear. Veronica is a Georgia peach. She is a sister to one of our other guests who we're going to see if she can make it. Actually, I see she's in our studio. And she's a close friend of WDT. Some of our viewers may remember her from our episode on COVID-19 and women, Lives on Hold, back in May 2020. She's an emergency tech in an advanced care center here in Atlanta and is currently a nursing student at Chamberlain University School of Nursing. We welcome Veronica. How are you doing, Veronica?
Hello, everyone.
Hi, Veronica.
And
Hi.
we're going to bring on Veronica's sister who was able to join us. She just got back from work and we're so happy she was able to make it. Ms. Krista Anderson Wimberly is a Georgia peach who hails from a town right outside of Atlanta. She is a home health nurse in Tallahassee, Florida, and sister to Veronica. Welcome, Krista.
Hey, everybody.
Hey, how are you?
So
Good.
I'm happy you were able to join us. I wanted to just, before we launch into our little segment with Amarachi and Jennifer, because they had a few things, I wanted to thank you all for sharing your stories. I know that you have had a hard time with COVID, both when you initially had it and now, and I want to welcome you to our show. Here are a few words from Dr. Amarachi and Jennifer. Let me start with you, Amarachi. When did COVID-19 first impact your family?
So the first close, I guess you can say, impact for us and my family was when we had COVID affect my father-in-law, my mother-in-law, and that was late March 2020. So we're still yet to figure out exactly how their contact to a COVID patient or whatever happened, but my father-in-law and my mother-in-law ended up testing positive at end of March. Unfortunately, my father-in-law got sicker so fast. He ended up in the ER about 4 or 5 days into the virus, was admitted to the hospital, spent about 2.5 weeks in the hospital on oxygen, high up to about 6 liters at one point. And this is a man that is like really healthy, strong, would work out up to 3 times a week. I'm talking like wakes up at 4:30 in the morning, gets up and does his exercises and prays. So
just fit and active.
exactly, fit and active. So when we saw him kind of go through the disease and being in the hospital and so tired and so weak, like even trying to talk to him, you could hear him panting. Like it was heartbreaking seeing him get so sick. Unfortunately, we got the news that, okay, yeah, he's getting better. We're going to discharge him. He made it home. And he was home for about a week. And then about a week and a few days after, my father-in-law passed away.
Yeah. I'm so sorry about that. I remember when you told me. I remember when I had both of your in-laws in my prayers, and I remember being so shocked and so sad that this had happened to your family. And so even with all that level of precaution, even stripping down to your underwear, wiping your mail, wiping your groceries, and being vigilant about keeping COVID-19 out of your home, tell me what happened.
And then I got COVID. Still don't understand how. So I'm certain that I most likely picked it up at work at some point, taking care of patients. But so I came home a few days after several shifts in a row, and I was just tired. I kept thinking to myself, okay, it's just because I'm exhausted. I've been working so many days in a row. I still got to take care of family. And so I figured, okay, the fatigue is most likely just lack of sleep. But then I noticed that at one point I started having chills and then congestion and runny nose. And my husband was like, it's unusual for you because I usually don't like to say anything about me not feeling good. But he's like, it's unusual for you to be so tired. I was like, yeah, I'm fine. He's like, okay, well, you're going in for a shift. Just go ahead and let them get you tested while you're there, just to be sure that you're okay. So, yeah. I went in, took care of everything I had to do, got tested. Then I get a phone call the next morning from a colleague of mine to tell me that my test was positive.
Wow.
I was positive for COVID-19. That was earth-shattering, for lack of better words. I just could not understand how. Like, what else could I have done differently? And
I'm going to pause for a moment, because what I'm trying to capture is this first notion. I want to capture the process of trying to protect yourself and also first thoughts when you are diagnosed with COVID-19. So it sounds like you had shock, disbelief, and I want to transition over to Jennifer to bring her into this story. I want to know a little bit about your process before you discovered you had COVID-19 and what it was when you first got that diagnosis.
Well, when I started off with headache and dizziness, and then shortly after I started with loss of taste, smell, tightness in my chest, shortness of breath. And then I got tested December 5th. So we were like right there at the same time. And it tested positive at that time. I knew when I lost my taste and smell that that's exactly what it was.
What I wanted to ask both of you, Amarachi, we know it affected your father-in-law, but now it's in your personal home. I want to know if any other members of your family were impacted by COVID-19.
Yeah, unfortunately, yes. My eldest son, who's 6 years old, ended up getting tested positive, and then my husband, who had just lost his dad.
This is what I want to ask you all, and I want your honest opinions. What do you say, or what do you think about people whose response to your stories are, sounds like COVID is uncomfortable, but you all survived. You're fine.
We're lucky that, there's so many people that lose their lives, and it's not a joke. There's, like I said, the friends that got sick and ended up going to the hospital. Literally, if they would have just stayed home afraid to go to the hospital, they may have lost their lives. It was that bad, So people, some people do walk away with, and I still don't have my sense of smell back, but a lot of people walk away without, death, but that doesn't mean to take it as a joke.
Yeah.
Absolutely. What about you, Amarachi? Thoughts on that? Thoughts on you survived? I mean, I know your father-in-law didn't. We're so sorry, but you did fine.
Yeah, I don't know. I feel like there's still so much more we don't know about what COVID is going to do to the rest of our body system. I can tell you from my personal experience, I still have the headaches. I know that some days I have, like you said, some migraine headaches, but there's a different kind of headache that COVID does. Like there's this like piercing, stabbing headache where you feel like you need to go lie down.
Right.
So I still get some of that headache and the back pain.
Back pain? Tell me about the back pain.
Ooh. So the back pain, it's hard to describe it for like, okay, so it's almost like you have a vice tightened around your back and the person is tightening it as tight and closely neat as they can possibly screw your back tight. It
sounds horrific. Is it upper back, lower back? What part of your back?
Lower back, like labor pain, like kidney stone pain. Like like when you have a bad fall, then times 10 of the bad fall on your back. That's how bad it gets.
Really remarkable. They had a little bit more to say.
Saying some people have like the loss of taste and smell and the headaches and the fatigue and the dizziness like we both had. Some patients don't have all those symptoms. Some patients just come in because they just don't feel right. I'm not going to disclose the name or any of the identifiers of this patient, but he came in just same way, didn't feel right, got tested, found out he was COVID positive. And then some of the labs that came back in showed that his kidney was failing. So that was literally the only symptoms was I just don't feel right. And then basically it was a lot of like the virus had attacked most of the muscles and the muscles breakdown need to go through the kidney to get cleared out. Well, he sent his kidney into kidney failure and now on dialysis.
Oh, he's on dialysis. So is this did he have rhabdomyolysis?
Basically rhabdomyolysis. And
so basically just like you described, muscle tissue breaks down, all those broken muscle tissue cells try to pass through the kidney for clearance and end up stopping up the kidney and causing it to fail. And then now he's on dialysis, essentially for those who aren't familiar with it, where you have a machine acting like your kidney, clearing waste from your body because your body can't do it anymore.
That's it.
And how old was this man? Do you remember age range?
In his mid-30s.
Mid-30s. On dialysis after COVID-19.
Young, healthy male. And I was going to add, and then my husband also now has like a little bit of what we call pericarditis. So it's basically where the inflammation of the muscle around the heart is causing irritation to the heart itself and now some fluid around the heart. So that's some of the residual sequelae. So unfortunately, just having the virus itself is just not the end of it. It's just realizing that there's some things that it's probably going to end up doing to the rest of our bodies.
And this is what I wanted to launch into. So you thank you for the perfect segue, because I want to talk about life after COVID. Because a lot of people feel, listen, I don't know if I really need to get the vaccine. I just need to not catch it. And if I happen to catch it, I'll probably survive it and that'll be it. And you all are telling us that there are still some symptoms that you and other loved ones that are facing. And I want you to talk a little bit more about that. Jennifer, you mentioned something about you still don't have, is it your taste or your smell or which one?
Smell.
Tell me a little bit about that, because I'm not gonna lie. When I first heard about this loss of smell, medically known as anosmia, I'm like, can you smell a little bit? Can you smell strong? Like, what do you mean when you say you can't smell? Like, you really can't smell?
It's terrible because, like, even at work, somebody will say, "Oh my gosh, what does that smell?" And I'm like, "What?" I smell nothing.
Wow.
What if something was extremely strong? Like, if somebody put perfume on your arm and asked you to smell it, you cannot smell it?
If it was it has to be super strong and right against my nose, and I can smell it a little bit, but it's not strong at all.
What's the worst thing that COVID has done to either of you? And that's a loaded question. It can mean anything. What's the worst thing that's happened to you because of COVID?
Honestly, I didn't speak about this, but my father passed away in April, and he did not pass away from, well, I hope he did not pass away from COVID, which, like you said, they don't do autopsies, but I feel like my dad was very big on not going anywhere, not going to the hospital, not going to the doctor, you know, just to kind of stay in quarantine. And I don't know if he would have gone to the hospital or the doctor if they could have prevented, you know, what happened, you know. So that it was a big effect on me that I don't know if this could have been prevented, you know.
Right. I'm sorry.
Jennifer, I'm so sorry.
Sorry.
I'm so sorry. And I think what you're saying, I really want people to hear this. Even if you don't die from COVID necessarily, there are people who are dying because of COVID on a secondary level, meaning they might have gone to the hospital. They might have had the care. They might have been able to get a hospital bed or get the attention they needed. Right. And they can't because the hospitals are either on strict protocols because of COVID, or in some cases, what we're seeing these days, just saturated, can't move patients because of it. So even if you don't get COVID, even if your loved ones don't get COVID, some way, somehow you will be touched by COVID is what we're learning. You mentioned the vaccine, and that's the last thing I'd like to talk about with you ladies is the vaccine. One, are you getting it?
Yes.
Yes.
So you realize that a lot of people would be surprised, like, why would you get it? You've already had COVID. Why do you need to get the vaccine?
You can get COVID twice. I don't want it again.
You know, ladies, I want to thank you so much for sharing your stories. I know it's hard to relive some of the terrible things that have happened in the past year, either directly because of COVID or secondarily because of COVID. And so I commend you and I really appreciate you.
Thank you. Thank you for having us here.
Well, that is Jennifer Grant and Dr. Amarachi Osisanya. I wanted to talk to some of our guests that are here live with us.
Yeah, and so I'm just going to start with Michael, and just kind of from the standpoint, when you give us an idea kind of when you had COVID and kind of what your predominant symptoms were when you had it.
Okay. So I tested positive in May, the beginning of May, or no, excuse me, mid-May of last year, 2020. So before I tested positive, I would say probably 2 days, 3 days prior, I was having some symptoms. They were mild at first. I was more so, I think the predominant symptom at the time was fatigue. So I felt just kind of run down. I felt, I just didn't feel good. When you feel like you're coming down with something, you're going to come down with a cold or flu, whatnot. Now the day before or right prior, I remember feeling I was getting a sinus infection. I was sneezing a lot. I was coughing, sinus drainage, had a headache. And again, the fatigue was going on. So I still, in my head, I wasn't thinking it was COVID. I was thinking I was just coming down with something. So that
think about COVID, even though we see it, none of us really think that.
Right. It definitely wasn't COVID. It was a sinus infection. It was a cold. That night, I remember going to sleep, and I woke up during the night. I had soaked through the sheets. I was, had a high fever, splitting headache, and just felt awful. So that morning, I was supposed to go into work, and I remember calling in and saying, I can't get out of bed. I can't do it. I just don't feel good. And that's when I went and got tested and got a call back that, I was tested positive for COVID.
Wow.
So about how long overall did you feel that way? I mean, from the standpoint, especially like that really feeling bad.
Right. So I would say, for me personally, the fever.
Looks like we lost Michael for a second.
Michael.
He'll join us again. But I wanted to, while we have Krista and Veronica talk to them, I know a little bit about Veronica's story because we do work together. I wanted to know, Krista, did you have a severe case like Veronica where you ended up in the hospital?
I had a severe case, but I didn't go to the hospital because I had it back in March of last year. And at that point, it was new. So I was scared to go to the hospital because everyone that was going to the hospital wasn't coming out. And I didn't want to be that person. I told myself I want to die at home. So I didn't go. It was bad. I started out with diarrhea. And then it went like the next day, like every day was just something new. And I started with chills and fever. Then it went like I started having eye aches and bad body aches, loss of sense, loss of taste. I'm sorry, huh?
Oh, I'm sorry. I didn't mean to interrupt you. Did you think you had COVID then, just starting off with the diarrhea? Because I know back then all of us thought, oh, it's just the loss of smell and taste and then the shortness of breath and cough. We didn't even think about the other symptoms. Did you even think you had COVID at that time?
I really didn't. I kept watching the news every day, and like when I lost my sense of taste and smell, and they were saying that was a new symptom. Then I was like, oh yeah, I got it.
Yeah.
I
wanted to mention that, I hate to interrupt you, but a lot of people are just like you, where they don't think they have it, even if they have kind of classic symptoms. I've had patients tell me, no, it's just congestion. No, it's just a runny nose. No, it's just a little allergies. And I just want people to be aware that, if it looks like COVID and walks like COVID, if you have anything respiratory, if you don't feel like yourself, unfortunately, these days it's COVID. It's COVID most of the time. I want to bring Veronica into the conversation because I know that you actually ended up in the hospital twice with COVID.
Yes. So I tested positive on November 20th. I was at work and my first symptoms were my hands were aching. And I couldn't figure out, I'm like, why is my hand aching so much? And then about 20, 30 minutes later, I started feeling like I had the chills. And I'm like, what is going on? What I felt like I was just coming down with something. All of a sudden, it just hit me all at once. I got to work at 7 o'clock, but I didn't start feeling any symptoms until around 11. And that's when my hands started aching. 30 minutes after that, I started getting chills. Probably another 30 to 45 minutes, I was like, let me check my temp. My temp was 99.4. And then I waited about an hour later and it was 100.5. I immediately told my supervisor, I'm like, I have low grade temp. My hands are aching. I'm having chills. And he said, well, definitely, do the protocol. We have to send you home. I said, well, since I have to go home, let me at least so I can get my negative result so I can come back to work on Monday because it was a Friday.
Right.
Lo and behold, I get the results and it came back positive. It wasn't until like maybe 5 days later is when I got to the point where I needed to be hospitalized. I started feeling, I ran fever for a week and a half every day. And then I started having a shortness of breath because I called my sister because she's a nurse and I was like, I'm having shortness of breath. And she kept saying, like, well, you need to walk around. And she tried to get me to go to the hospital sooner than what I did, but I didn't. Right. And I'm like, maybe it's just, I just think I'm going to be okay.
And I think most people, I'm so sorry to interrupt you. I was going to say most people in your position, I mean, you're young, you're generally healthy, and then there's also the notion of you not wanting to go to the hospital because I feel like a lot of people, when they go to the hospital, like, oh, this is real. This is real. Like, I have to accept that I'm really sick. So there's a little bit of denial. Would you say that might have been the case?
Yes, that's exactly what it was. I was like, I just thought maybe I was overthinking it. I'm like, nah, I don't want to go to the hospital. And then, so it got to a point where I felt like, okay, let me just call 911. So the ambulance came out and then they was like, well, your oxygen right now is at 95%. So that's pretty good. And they started asking me questions. And they said, well, when do you feel like you're short of breath when you walk around? And I'm like, yeah. They was like, oh, well, normal. That's how it's supposed to be. So basically they told me I didn't need to go to the hospital because that was expected. So I'm like, okay, I'm thinking, well, maybe I'm just overreacting. I've never been short of breath before. So I'm like, okay, I'm just chill. The next day, I couldn't breathe at all. I just said, okay, well, I'm not dialing 911. Let me just go to Kaiser and check in and let them check me out, because maybe I'm overreacting again. But when I got there, I think my SATs was like 85% at that time.
85%. Wow, that's low.
Yeah.
So just for those who are not familiar, we like SATs above 95%. That's a normal saturation. Oxygen saturation is what we're talking about. In COVID patients, sometimes that number will go dangerously low, well below 94 or 95%. In your case, you said it was 80, what?
It kept dropping. It was between 83 and 85.
Wow.
So the lowest it got was 83.
Wow. So you definitely struggled and needed supplemental oxygen.
Yes.
I want to switch gears a little bit because we know you all had COVID and you all experienced it differently. What we want to talk about now is the long-term effects, because let me see by show of hands how many of you are still having significant effects from COVID. Can you guys show me? I think it's all of you. That's why I asked you. Sonia, you too? Wow. Okay. What would you say is the worst thing that you're experiencing nowadays, months, in some cases, almost in your case, Michael, more than half a year after having COVID? What's the worst thing that's happening to you now?
Mine is the shortness of breath.
Oh, so you're still short of breath? Okay.
For me,
Michael?
Yeah, I would say the same for me.
Oh, so you're still having shortness of breath? Like, is it the sort of, when you say shortness of breath, because even some patients, when I ask, are you short of breath? They're like, what do you mean, doc? When you're short of breath, do you mean that it's hard for you to take deep breaths? Do you mean that it's hard for you to catch your breath if you exert yourself? Do you mean that you just feel like you can't breathe? What are you talking about?
So for me personally, when I describe shortness of breath, it's as if when I'm doing even light tasks at times, it feels like if you just went sprinting. If you just you sprinted for 3 to 5 minutes. That's how it feels. It feels like it's hard to catch your breath, I guess I would say, versus can't take a deep breath. It feels like, man, I just feel winded, and that's kind of a lingering long-term effect that I've been experiencing.
Did you ever have any problems with your lungs prior to that? Like, do any of you have asthma or any lung problems before you had COVID? Michael, did you have any lung problems, asthma?
None.
No, I didn't.
Non-diagnosed, no.
What about like fatigue? I know that's for me is a big thing, is fatigue, as well as I don't know, for me, when I had it, I had such bad insomnia. I still can't sleep. And so I don't know, like any of that kind of stuff. Are y'all having that or experiencing any of that?
I did at first because I was scared to go to sleep because I didn't think I would wake up.
Gotcha.
That a lot of people have told me that, even in the emergency department. I've had a lot of people say they're scared to sleep because they think they won't wake up. So Veronica, you're definitely not alone in terms of COVID patients that have told me that.
And what
Krista,
about
Krista, you were trying to say something. Yeah. Sorry, we cut you off. Krista?
Yeah, I had a lingering cough up until December.
Oh, wow.
It was like every night.
When I've been talking to people who have had COVID, they've also told me, some of the long haulers, that there are some symptoms that were shocking to me that I didn't recognize were a part of what people were experiencing. And one of my friends was telling me that she has clumps of hair just falling out. And she had COVID back in June. She says, and she has healthy hair. She's healthy generally. She's never had problems with this. And she thought it was just her. And then she went online and she saw there were all these support groups for people who were losing hair who had COVID. Can any of you speak to that? Has that been any of your experience?
That's been my experience. And when my hair started falling out, I didn't even think they link it to COVID until actually I had that conversation with you, Dr. Ipe. Even before I got hospitalized and even after I got hospitalized, I had big balls of hair coming out. Now it's starting to it's not as much, it's not as bad as it was in the beginning. But when I wash my hair and comb it with the conditioner, I mean clumps and clumps and clumps of hair. Like my hair is so short now to the point. That's the reason why I wear like weave or extensions and stuff, because I can't wear my hair out no more because it's so short. And my sister, she can vouch for you. She can tell you how bad my hair came out. At first, I was linking it to the dye because I thought maybe the dye was taking out my hair. But prior to me getting COVID, my hair was already dyed and it wasn't coming out as bad. But once I got COVID, it started like really coming out really, really bad.
Yeah, it's not in your head for sure, because I've researched it a little bit after I started hearing about it. I want to just let our viewers know about something called telogen effluvium. And it's basically a temporary hair loss that occurs due to deep stress or a very highly stressful period. Sometimes you'll see it in patients after fevers or prolonged illness, starvation, and so forth. And when I've been reading about hair loss in COVID-19 long haulers, that's what the dermatologists are saying they think is responsible for it. And the good news about it is that even though it can be months and months, a lot of times it's temporary. So that's a shocking symptom to me. I did not know that people were losing their hair after COVID. Another thing that shocked me, there was a patient that I knew of that had a loss of her leg, and she was in her 40s, and this was absolutely shocking. This was like, what is happening here? It turns out that COVID-19 makes you more susceptible to developing blood clots. Sometimes you'll develop them in the deep veins of your legs, and they can go to your lungs, and that could be life-threatening. It's called a pulmonary embolism, but they can also develop in the arteries of your body. And this particular patient had a blood clot in one of the arteries of her leg, and it was just discovered, by the time they discovered that that's what was going on, in somebody who never had a history of blood clots or problems, she had to be amputated. So I just bring that up to note that there are a lot of very shocking, lingering side effects and symptoms of COVID-19 that we are seeing in our patients and in our friends like you all. I want you all to just tell me if there's any other shocking or concerning symptoms that you've been having, or any thoughts about this whole COVID-19 long hauler syndrome. What surprised you the most about what you're still experiencing?
For me, I didn't realize I would still be short of breath like the way I am. So it's to the point where my doctor put me on to where I can't push wheelchairs anymore, because in my duty, I have to push patients to either CT or MRI, and I can't even do that anymore because I had an incident where I pushed a patient to CT, and I was so out of breath that the patient felt so sorry. She just kept asking, "Are you okay? Are you okay?" And I literally had to sit down to catch my breath. And I told the CT tech, I said, "I'm sorry, I don't know if I see if I can get somebody else to bring the patient, but I can't do it." Like I was so out of breath to the point, like I felt like I couldn't catch my breath. Like, but after I sat down for a minute or two, I was able to catch my breath, and then I was able to, walk back to the ACC where I work at.
Wow. Well, we're going to close this segment, but I just wanted to thank you all for coming on here and talking about what's going on. I want our viewers to recognize there's nobody on this stage, any of our guests here talking about this that's even up to the age of 45. Okay. These are young adults who, from what I understand in talking to them, never went to a doctor really for any chronic diseases, at least certainly not any lung problems. And now, months and months and months after having COVID-19, will be walking around their work and have to catch their breath. Michael, I think you shared with me that you were going to see a pulmonologist, a lung specialist at one point. Is that correct?
Correct, yes.
Right. So, and then we have things that maybe aren't as daily impacting as not being able to breathe, but things like losing your hair, things like not being able to smell. These are things that nobody wishes on anybody. And so I want people to understand that COVID-19 is one of those diseases, when it hits, sometimes it doesn't let go. Sometimes it does not let go. And so we just need to be aware of that. I want to thank you all once again. Sonia, thank you for also sharing what you've been going through with the fatigue and everything. And we're going to transition right now. We're going to bring on our guest experts to talk a little bit more about the vaccine, Thank you, Michael. Thank you, Krista. Thank you, Veronica.
Thank
You're
you, Dr.
welcome.
Appreciate
Before we
it.
bring
You're
on our guest, before we bring on our guest, just a brief word from some of our sponsors, including a little PSA.
Have you consistently dealt with skin reaction? Is your skin tone uneven? Do you have a strong desire to consistently look radiant without the use of excessive chemicals in the name of cream? Well, luck just found you. Judy U Care skin care products might just be the long-awaited breakthrough for your skin, as they have developed organic-based skincare products just for you, so you keep that elegant look without damaging your skin cells. Product like cream, serums, toners, mask, moisturizer and cleanser. You know the most interesting part. It cost absolutely nothing to check out the website, www.judyyoucare.com.
Hi, I'm Dr. Anwar Osborne. There's been some confusion lately about wearing masks, and I want to give you the facts. Masks are like your drawers. Follow drawers rules. Rule number 1, don't let anything hang out. Nothing should be peeking out of your drawers ever. None of this. None of this. You can't bird box the Rona. Rule number 2, don't adjust in public. Would you really dig deep to pick out a wedgie? No. Don't adjust them in public with your hands. Your hands carry germs. Wash those nasty things before you put your mask on and before you take it off. Rule number 3, keep them off the table. When you go to a restaurant, would you just casually toss your dirty drawers on the table? I don't need your Fruit of the Looms next to my guacamole. No bueno. Rule number 4, wash them or be nasty. If your mask has more stains on it than the Tupperware you use to store your tomato sauce, you got problems. If it has holes in it, trash it. Wash your mask. Rule number 5, don't swap them. Don't share them with your friends. Hey, bro, can I borrow your boxes real quick to just run in that store over there? I mean, for real, remember the rules. Don't let anything hang out. Don't adjust anything in public. Keep them off the table. Wash them or be nasty. And don't swap them. Most importantly, wear them. Now you know. Don't forget it.
We always love that mask commercial by Dr. Anwar Osborne. He is very funny, but he's actually bringing a very good point up. We need to continue to wear our mask. We're talking about the vaccine, but we need to make sure that we continue to mask, wash hands, and socially distance, even after we've been vaccinated, right? So without further ado, I want to bring on some of our guest experts because many of you have questions and they're going to help us break down some of the controversies surrounding the vaccine, as well as imparting some good information about the vaccine. So let's go ahead and start off with our introductions. We have Dr. Xanthia Wiley. She's rejoining us from our broadcast last week. She is an Emory infectious disease specialist. She graduated from the University of Alabama Medical School, after which she went on to complete her residency in internal medicine at Emory, as well as her fellowship in infectious disease. She is the director of antimicrobial stewardship at Emory Midtown Hospital and co-chair of the Emory COVID Treatment Guidance Committee. We are delighted to have her here again with us. Welcome, Dr. Wiley.
Thank you for having me again. I've really enjoyed the show so far. This is fantastic.
Well, thank you. Now we'd like to bring on Dr. Rena Garcia. Dr. Garcia attended Yale School of Medicine and has been a primary care doctor in Connecticut for 13 years. She has predominantly taken care of African American and Latino patients throughout her career and sees herself as an advocate for all of her patients. She was born in Peru and immigrated to the United States at the age of 10. Welcome, Rena.
Thank you so much, Dee.
Thanks so much, Dr. Garcia, for being here. I would like to also bring on with us Dr. Giannis, or Dr. Giannis, as he also goes by, Hodges Memaletsis. Dr. Giannis is an infectious disease epidemiologist who is based in Geneva, Switzerland, and has been a consultant with the World Health Organization since 2013. He trained both at Yale University and Oxford University. His expertise and focus is on HIV infection with a specialization in the area of pre-exposure prophylaxis and sexual reproductive health. As many others in the field of HIV, he has had to pivot and work on COVID-19 for the past year. Got to multitask. Welcome so much, Dr. Yanis.
Thank you very much. Delighted to be here. Really a privilege, and I look nothing like that photo that you just posted. It's a bit of an older photo, and as a result, I think like with many who've been stressed out through the pandemic, I've gotten a bit of more gray hairs, and I definitely don't have as fabulous hair as you do, Dr. Didi. So thank you all for joining this wonderful discussion and group. And again, congratulations on having this platform for community engagement and community education around COVID-19. It's really wonderful.
Thank you. Thank you so much. And we'd like to bring on our last expert guest. Dr. Natasha Kathuria is an emergency physician and global health specialist in Austin, Texas. She completed her residency in emergency medicine at Emory University and her master's in public health and epidemiology at Columbia University. She did her fellowship in global health at Mount Sinai and has worked in 11 different countries over her career. Dr. Kathuria also works as a medical journalist and has been covering the COVID-19 pandemic on national and international news networks, including BBC, ABC, CBS, and Fox News since March of 2020. We are so honored to have her here with us. Welcome, Natasha.
So nice to be here with all of you. Thank you so much for having me. It's really an honor.
Well, thank you. So we brought you all on here. Some of you, Dr. Wiley, you were here with us last week, and we talked a lot about the vaccine and how it works. But today we have to talk a little bit about the controversies and concerns about the vaccine itself. I have a question here from Josh Parsons. Should people take precautions after they get vaccinated? I am going to definitely answer that actually myself. We do need to take precautions. As we've mentioned last week, and we continue to mention, masking, social distancing, washing hands are important because there is some suggestion that you may still be able to spread it even if you are vaccinated. And it's not 100%. It doesn't mean that you won't at all be exposed to the virus. It just means that you will not get sick from it and certainly not die from it. The first topic that I wanted to bring up was actually the whole notion of the Black community and the COVID-19 vaccine. When I say the Black community, we might also bring in other communities of underrepresented minority groups. But with the Black community, we note that there is quite a bit of mistrust in this vaccine. Have you all noted that in your clinical practice? I see people nodding their head. Okay.
Yes, I can start. Absolutely. So I see infectious diseases patients in my clinic. And about 3 weeks ago, I had 10 patients scheduled, and I decided that I was going to ask each of them, how do you feel about the COVID vaccine? Are you interested in receiving it? And 9 of my patients were Black, and only one of them said, yes, I am interested in receiving the vaccine. And that one person was a registered nurse. So, we sat and had a conversation. Tell me why you're not interested. What are you concerned about it, et cetera. So the great thing is having these one-on-one conversations, healthcare providers, we can fortunately, change the minds and dispel a lot of those myths. But, there are plenty of myths. I think we've all seen them on Instagram. Oh, this was developed too quickly. There are tracking devices.
Right.
These are being targeted to Black people. So I think really the key is education. We have to have, those one-on-one conversations with people. These venues are fantastic, but literally all of us have to talk to our loved ones and our patients.
Great. We're going to talk a little bit. We're going to definitely answer your questions in an open Q&A session in just a few moments. But I want to kind of piggyback off of what you just mentioned about your patients who are Black who have their concerns. It's not an irrational concern in terms of the mistrust of medicine. That's what I mean. This vaccine, from what we understand and have studied so far, is safe and it's effective. We know that. High efficacy, especially for the 2 that are available now. But there has been traditionally a mistrust of the medical establishment and scientific community, and it was well earned because there throughout history have been instances where the Black community has been mistreated, used, sometimes frankly mutilated. And so that historically has a precedent. I want to talk about the most famous incident because it is Black History Month. And in celebrating all of the achievements and wonderful experiences, we have to also reflect on some of the less pleasant ones. And one of them that's pertinent to what we're talking about today is probably the most famous. It's the Tuskegee syphilis experiment. This is an unethical study which was conducted for over 40 years, or about 40 years, by the United States Public Health Service and the CDC. And the purpose of the study was to observe the natural history of untreated syphilis, even though a treatment, penicillin, was available by 1947, almost 30 years before the study closed. The men who were enrolled in this study were rural African-American men, and they were told that they were receiving free health care from the US government, but were instead allowed to progress to severe illness from the late stages of syphilis, which can include things like damage of the brain, eyes, heart, bones, joints, and liver. Out of this, and because it was recognized to be unethical, there was an establishment of the Office for Human Research. And this actually helped us develop institutional review boards for the protection of human subjects, because they recognize that we need to make sure that when we enroll patients in studies, they are protected. You should also know that on May 16, 1997, President Bill Clinton formally apologized on behalf of the United States government to the victims of this study, calling it shameful and racist. And the reason I bring that up is twofold. I want to explain that we definitely have a history where we have to earn the trust of certain communities. And the second is to let some people in those communities know that there are some corrections of these mistakes. So after that, it was recognized that this is terrible. This never needs to happen again. And so study subjects have some protections now. There are review boards that meet up and make sure that those who are involved in studies are not being mistreated, that they're not facing any unethical practices. And I think that's important when we're talking about this vaccine, because I hope that it helps to instill some trust in participants of all communities. Okay. I see over here, trust in the vaccine and also trust in the United States system is in place by the FDA. But we'll talk about, so you're on the show, Dr. Yanis, talk to us a little bit about that.
Yes, absolutely. So I think kind of a big point for the audience. We are very lucky to have not just one, not just two, but up to at least 6 vaccines for which we have data. And the fact that these vaccines, based on the data that we have right now, are highly efficacious. So that's the nice word in clinical trials, which means they work in doing what they seek out to do, which is prevent disease. For at least 6 vaccines for which we have data, and that includes the 2 that are currently authorized in the United States. That's the Pfizer-BioNTech and then the Moderna vaccine. Actually, they're 100% effective in preventing death and hospitalization. So that needs to be underscored to participants. Mm-hmm. The next thing is, I would say that, nothing in medicine is 100%. And so I come from the area of HIV prevention and pre-exposure prophylaxis, which is the use of an anti-HIV drug that's typically used for treatment, but now it has an indication for prophylaxis. So, in sort of layman's terms, I can say that people that struggle using condoms, don't like using condoms, can't negotiate condom use. If they take this drug before and after sex, they're highly protected from acquiring HIV. And so, but again, it's highly effective. It's 90 to 99% effective, but it's not 100% effective. So I think this is kind of a standard rule in medicine. In terms of this, sort of getting to the point around the system in the States and also globally, the structures that are in place to authorize these vaccines and bring them, to people. Typically, a vaccine or a drug takes many years to develop. So obviously, the questions by the larger public that we've constantly heard is how can I put this in my body when you've developed something so quickly? I always reverse the question and say, why does it take so long actually to develop potentially life-saving medicines and vaccines. Obviously, given the state of the pandemic and the urgency, we put a lot of money in vaccine research up front, into the research and development. You've seen something very positive. I mean, even though we're in a very sobering time in terms of cases and deaths, there are certain things to celebrate, and that is solidarity amongst the global community of science that has banded together to bring to you under 12 months vaccines into populations. And
absolutely. Well, you talk about the global community. I just want to kind of switch gears a little bit now to talk about immigrant communities. So we talk about the Black community and the history of mistrust. And we hope that with some of the developments to protect study subjects and also the safety that you talked about, that will get some trust. We also hope that seeing faces like mine and some of the other people who are in the Black community, not just talking about the vaccine and educating about the vaccine, but also putting our money where our mouth is and getting the vaccine will help that. But I want to extend the discussion to the global and immigrant communities here in the United States, because there are some communities that are more willing to take the vaccine than others. Dr. Garcia, you mentioned to me that you take care of a lot of Latino and Black patients. And I know that you've kind of been more virtual and not as much in the clinic, but what have been your impressions in those communities? And not just that, but also immigrant communities, if you could speak on that a little bit as it relates to the COVID-19 vaccine.
I think people are generally willing, and I actually surveyed a few other Latino doctors across the country just through a Facebook group we have, just to kind of get a wider perspective than my own. And I think especially in impoverished communities in which Latino immigrants often are, there is a lot of interest in the vaccine. People seem to understand herd immunity maybe a little bit more because they know the stakes of what going back to day-to-day work, maybe on the street or a manual labor job may mean in terms of the whole country sort of getting healthier and getting past COVID. So they know the stakes are high. These are populations where they may be keeping their kids home because they're not working, but they're also maybe a little bit more scared because they see the higher impact in the news that our communities of color have had from COVID. So, but certainly there are pockets also where they are being discouraged sometimes by doctors themselves who aren't necessarily, who haven't crossed the bridge in terms of accepting the vaccine for all its benefits. So there is also a lot of attention to social media. There was an article actually that Latinos disproportionately pay attention to social media networks, that by being the community-driven people we always have been, that through the pandemic, that has really stretched out into virtual communities. And so there is a lot of attention to what's going on virtually in those communities. So I'm thankful for programs such as these, which can reach virtually through social media to all those patients. Now, of course, then there's the barrier of the language and people being able to access even the information for the vaccine. I'm in Connecticut, where it may look very different than in California, where programs may be more in Spanish, or access may be more accessible, or maybe more available in Spanish. So I think that's an added barrier, especially I see it for seniors who may be lower tech in order to get the vaccine appointments. There is a phone line in Connecticut, and we generally have good accessibility, but I think having the language as a barrier. Someone mentioned that in their clinic, they're actually, for the Latino patients, they're actually actively calling them to make appointments for the vaccine for them. And I know some folks have had community centers also put out computers and have helped seniors make appointments because they may not be able to.
Those are all wonderful points, and I'm glad that they're reaching out to those communities. You really mentioned something that I think is really important, and that is the significance of social media as a news source for so many people. It's not just the Latino community. I mean, there's a lot of people who don't listen to news and they listen to social media. So we have to be very careful. It kind of brings me to our next topic, which I want to talk to Dr. Natasha first about, because I know that you're on a lot of news stations and so forth, but behind the scenes, as we all know, there are many people who are spreading misinformation about COVID, about the vaccine. There's a lot of politicization of COVID-19 and the vaccine. And there's a lot that we have to compete against. I myself have seen other people who are also trained clinicians, so doctors, epidemiologists, or people who are at least trained in those, who will get up and say things. Like there's a doctor I saw on the news. I looked this doctor up to make sure it was true, that this was a doctor, because I was just shocked. But this doctor was telling patients that when they get the COVID vaccine, the COVID swab, to test if they have coronavirus up their nose, that they're actually being vaccinated, and that there are nanochips on the Q-tip going into the nose. This was somebody who was an MD. Now, this MD has not practiced for many years. She's 83 years old. She's been discredited, widely discredited. I don't even want to really say her name. I can always DM people if they want to know who it is, but this is what we're up against. So tell me your process, Dr. Natasha, in spreading information when you have that to go up against. How do you combat this? How do you share and go against these misinformation campaigns?
The battle of this era, I feel like this pandemic has really highlighted how much misinformation is out there, and how with social media and the internet and all of our networks, we are our own news stations. We can give information, and we need to understand, every single one of us, our power. It's not just on ourselves and our friends, but anything we post, how far it can go, and really acknowledge what role we're also playing individually. Just as you said, we are all, as physicians and nurses and anyone who's working in the hospital setting, any healthcare workers, we all have a chance to stand up and really spread powerful messages right now. And I think it's really important that for the general public who's looking for information, to check the sources that you're getting it from, and make sure that they're valid sources, that, you're not just reading doctor in front of someone's name and automatically trusting someone. Are they a medical doctor? Are they not? Are they trained? Are they still practicing? And always double check the information, because it's difficult. We are constantly, half of the stories that I was asked to do at the very beginning of this pandemic was just to come on air and explain why rumors that were spreading virally were not true. And the most crazy things, just like you were talking about with microchips and, Bill Gates kind of trying to control all of us, and just crazy conspiracy theories. And
I'm going to interrupt you just 1 second, because I have to show you something. Take a look at this. So this was something that was actually posted on the When Docs Talk comment page. People came to our page and posted this picture of Bill Gates and Dr. Anthony Fauci on a big vaccine ship, or I guess a jet, talking about depopulation. So I definitely understand what you're talking about. And you raise a very good point. Dr. Yuli, I want you to talk to us a little bit about a recent misinformation campaign. And it kind of extends into another topic we're talking about here, which is bullying. There are some people who have accused the medical community of pushing this vaccine and pressuring people into taking this vaccine. And I think it stems from our excitement as a community and our desperation for this pandemic to end. We're so excited to have another weapon against it. So people see us talking about it. And of course, there's a slant towards it because most of us endorse it and think it's a good tool. I think I see us all nodding our heads like, yes. But some people feel pressured by it. So we're here at When Docs Talk. We want to make sure we don't make people feel pressured. We definitely encourage it. We definitely endorse it. But we want people to make their own decisions based on good, sound information, which we provide for them. That said, on the flip side of it, which you're going to tell us a little bit about, Dr. Yuli, there are also people who are bullying and pressuring physicians, epidemiologists, and healthcare providers to shut up about the vaccine. They don't want to hear about it. They say that we're poisoning people and so forth. So tell us about some recent scandal regarding this vaccine misinformation.
So there is another social media platform. I'm not aware if I'm privy to say the name of it, but there's another where there are audio conversations about different subjects. And there are a lot of doctors who are involved in these and who have been putting up rooms about COVID. And then the vaccine came out, and there was a lot of rooms about people saying, oh, okay, the vaccine's coming up. And then people started getting vaccinated. All right. And so then there became rooms about, I got the vaccine. This is how I'm feeling, kind of just firsthand debunking. I got the vaccine. I feel fine. I haven't grown a third arm. My 5G still sucks. Those type of things, right? Well, some people crawled from whatever privileged rock they live under and have decided to voice what they feel like is going to be the cure for COVID, and saying that all of us are all weapons of the government, and that we all have plans to just push this on our communities respectively. So they basically we all can just get under control from the government or die or get some kind of unknown side effect. And like I said, these people crawled from their privileged rock and decided to voice their opinions, and their followers kind of came along with them. And I'm not talking about, oh, they've got 100 followers. I'm talking about thousands of people.
Thousands of people. I want to throw up some of the comments that were made. Essentially, I'll refer to the one on the right. One of the people who would be considered a celebrity, like you said, with a pretty big platform, talked about some Black physicians who were trying to teach about the vaccine, saying that it was these anti-African, self-righteous, jealous MFs who got my account suspended because they were saying I was a celebrity spreading misinformation. First of all, who made you the information police? Second, why didn't you address any point about Africa? Then list or put their picture up. So put several doctors' pictures up. And then X's went out and said the ones with the X were cool. The rest are government agents. Okay. Have you all in your experience had patients coming in talking about either social media, celebrities, anything that they've heard kind of online or around the way that has made it difficult for you to either educate or encourage the vaccine? Anyone?
So I've actually seen some of it myself that really, really disappointed me. So one of my favorite gospel singers was posting anti-vaccine information, and I was horrified and subsequently unfollowed. So if I'm seeing this and a lot of other people are seeing this, I think the great thing is when my patients come in and ask me about it and we kind of talk through things, having those one-on-one conversations make a tremendous difference. So are people and really kind of high level people out here saying things that are just factually incorrect? Yes. And what I always tell my patients are, everyone's hearing a lot of data, the percentage of this or the percentage of that. What I like to tell them to keep it nice and simple is that Black people are 3 times more likely to die from this disease. And I've seen it over and over and over. And I'm tired of seeing people, anyone who dies, but seeing people who look like me consistently dying. And then when it comes to getting the vaccine, we are 3 to 5 times less likely to get the vaccine. So who's left in the middle of this and who is suffering and who is dying? It's us. So we're the ones who are missing out. So that's what I like to tell my patients. And also, speaking of stats, this was really kind of mind-blowing to me. A couple days ago, I saw that of everyone who has received the vaccine in the US thus far, 60% are white, 5% are Black, and I think it was about 12% are Hispanic. So we're dying, at disproportionately high levels. Receiving we're and receiving vaccines much less than everyone else. So if we want to save ourselves and our loved ones and our grandparents and ourselves, we have to buckle down and stop some of the social media madness and take control over our own health. And one of the things that we can do is by getting the vaccine.
Absolutely. You know, you mentioned something, and I want to transition really quickly because this is another important point, is you mentioned about one of your favorite gospel singers. And one of the controversies that we at WDT wanted to talk about was the controversy of reconciling faith with taking the vaccine. Because I have seen people in different faiths have expressed their concerns. And in the Christian faith, for instance, I've seen on some message boards, and not all, because by and large, even there's somebody who's in a high leadership position at the NIH who's a very devout Christian who supports the vaccine. A lot of Christian faith leaders, including the Pope of the Catholic Church, who has endorsed the vaccine and taken it himself. The president of the Mormon Church has taken it himself and they endorse it. But there are some places where you'll read it's the mark of the beast, or it's, you know, it's not in alignment with your faith to take it. And so I want you all to speak a little bit about what you have experienced with discussions on faith and religion and the COVID-19 vaccine.
I haven't seen the issue of the mark of the beast come up for myself, but in other discussion groups, it has for many others. And I think the approach that seems to have generally worked, besides obviously presenting information and going to the part of the Bible where it speaks about the mark of the beast and what that actually looks like, right hand, forehead. You know, if people really can't get past that, you know, there's been a talk of like, well, maybe you could just get it on your left arm, and you know, and then it doesn't even have to be
right. Well, somebody also brought up another point, like in the Christian faith, since we're talking about that and mark of the beast, you have to accept it. You have to knowingly accept it. So you can't be tricked into accepting the mark of the beast. I did read that there were several people of the Islamic faith, several imams who were trying to advocate for the vaccine and explaining that it is halal, so it is acceptable to take. That's important to note because there are legitimate questions. I think it's important for us to not kind of dismiss people's concerns, even though some of them that seemed crazy and far-fetched. And there are some that are crazy, and there are some that are a little bit crazy, and there's some that are very reasonable if you think about it. And so I know that with the Islamic faith, there were imams trying to tell people that it was halal. And with the Jewish faith, even the Orthodox Jews, except for one sect of them, rabbis have been trying to advocate for it. So by and large, different faith groups throughout the world and their leaders have really come to the forefront and tried to promote this vaccine, which I think is important and helps us a little bit when it comes to misinformation campaigns like these. So over here, they tried to compare one of the Kissy Corbett, very instrumental in the development of the Moderna vaccine, compared her to Miss Rivers from the Tuskegee syphilis experiment, which was really horrifying of a comparison. They're there. There are people who on our website talk about who would want a DNA altering, useless and dangerous vaccine from a depopulation criminal psychopath. They have called the doctors at When Docs Talk communists and said, don't trust doctors following the communist agenda. Just for the record, here at WDT, we do not support or endorse communism, racism, fascism, sexism, or any ism that doesn't make any sense to us. I say that in jest, but it's really not funny. In the last few moments, since I have you all on here, there are a lot of people with questions. I want to just open the floor out to our viewers to ask questions. And we'll start off with one that I saw earlier asking about fertility and the COVID-19 vaccine. Does anyone want to take that question?
I'm happy to take that question. So there are some concerns that have come out about the vaccine targeting a certain cell within a woman's uterus that may render her infertile, and the same in men. So there is no scientific evidence to say that that is the case. And the American College of Obstetricians and Gynecologists have put out a statement saying that receiving these vaccines are safe, and anyone who wants to have children, as well as breastfeeding women as well. So the vaccine is safe.
I sort of responded to that. Thank you, Dr. Zanthia. Indeed, and I think it's very important also to have like very clear information for the public around, because there's many women, many couples that want to conceive in the next few months, and I get these questions all the time in my inbox from friends, colleagues who are actually working in the space, or healthcare workers. But just because I pay attention to the clinical trial data and the implementation data that's coming out from, as I said, real life implementation. And that's really an important point, that we're actually having, these clinical trials, which actually did not actively enroll pregnant women, but in real life implementation since December here in the US, we've had, I think, over 34 million people as of today that have gotten at least one dose of Pfizer or Moderna's vaccine. And amongst those, there are, pregnant and pregnant women and some breastfeeding women. And there's currently no evidence to suggest that it's pointing to any sort of adverse events. I will say that importantly, and I'm not a clinician, I'm an epidemiologist, but maybe the clinicians can speak to this a bit more. We have some data that's emerging on, at least for men, that having COVID-19 can impact actually, has an impact on the sperm, and so potentially on fertility. And obviously, COVID-19 infection in a pregnant woman may result in some complications. So I think it's rest assured that there's so much infection transmission right now with COVID-19 in the US that, I suspect that most of you probably advise, your patients and counseling them as to, getting the vaccine. But again, that's a conversation between patient and provider and clinician. And you weigh the risks and the theoretical risks and the benefits of giving COVID-19 vaccination, especially at this stage in the pandemic, when you just have just so much transmission in the United States. Okay. So over to you.
Great.
I want to comment real quick that if you keep your eyes peeled, because there are the women who got the vaccine who got pregnant shortly afterwards, those babies are getting close to being born. So there's going to be some new stuff come out probably within the next 6 to 8 weeks, I expect. So those of you who are super concerned about it or interested in it, including myself, look out for that type of information.
Okay. We have a question from Dania Halbok. Sorry if I mispronounced your name. Would the vaccine help with the lingering effects of COVID? We talked a lot about COVID, long COVID and long haulers. Any information, or do you all want to speak to whether it might help with that?
I can just say, based on the evidence that I've seen from the sort of American trials and some of the other studies, there's no evidence to suggest that. I would like to just point out, and it was a point made earlier by one of the guests. We say that reinfection with COVID-19 is a very rare case, but we're just seeing now with these new variants, especially in South Africa, and it was demonstrated actually from 2 of the vaccine clinical trials down there, that actually having had COVID before was not protective from you getting reinfected. So I think it's just an important point to underscore that people that recover from COVID-19, if you've had COVID-19 and if you've recovered from it, then based on the American CDC guidelines, that you should get the vaccine when it's your turn. Maybe the clinicians can have something else to say on that.
And I would just say, I agree with you. We don't have data on if you've had COVID and now you have long hauler syndrome and now you have lingering effects of COVID, if the vaccine's going to change those symptoms after a prior infection, we don't know. But will it reduce the likelihood of you getting long hauler syndrome? Sure. Absolutely. Getting the vaccine is going to, of course, reduce your risk of getting symptoms, period. So that includes those lingering side effects. So if you're worried, as we all are, of long hauler syndrome and of lingering effects and short breath that lasts for months, the vaccine is really your best weapon against this virus.
Absolutely. Really good point, Dr. Natasha. One question that I had from somebody was about something called ADE, and it's actually a concern that's been expressed. I think I discussed it with you, Dr. Wiley, earlier. Can we talk a little bit about ADE for those who are concerned about it and your thoughts as per that with this vaccine?
Do you mean adverse drug events?
Not adverse drug events, but the notion that you can have basically expression, or if you after you take the vaccine, you can have a sensitivity reaction, sensitization of the cells, where it actually will drag the virus itself into the cells even after you've been vaccinated?
So I'll be honest with you, there's not enough evidence out there for us to say with certainty that happens. So I've heard, some of this out there, but I have not seen the evidence that confirms that this is truly a thing. But curious to see if other folks have heard anything.
Just based on my sort of kind of according to what I know from the data and just like looking at certain other vaccine groups, there's no evidence to suggest that this is actually a thing, as you said, right now. But that doesn't mean obviously we don't have proactive monitoring. So in my mind, I always think that, and want to think that the key things to public health that COVID is doing is actually we all have a microscope on top of the vaccines and the virus and these variants, and that's because we have genomic surveillance, in countries, and we need to increase that capacity here in the United States as well. But I sort of am, I want to say that I'm comforted, let's say, that there's so much focus and attention on the safety of the vaccine, even as we've sort of come out of the clinical trials and now we're vaccinating millions of people. So I think there's, as I said, there's systems in place and active data gathering that's reported centrally. And there's a lot of transparency on that by CDC, FDA, and WHO, where, they're reporting in real time if they see something that is suspicious.
Absolutely. And it's also important to note that those who have been vaccinated are developing early neutralizing antibody protection at really high rates. And if there was this notion that they could have this sensitivity reaction, which would make them more susceptible to the virus in the future, which happens with certain vaccines, we would see that. But rather, we're seeing that those who have been infected after they've been vaccinated are not developing severe disease. So it suggests to me that that's not the case. Are there any? Oh, sorry.
Sorry, I just wanted to say that we just need to be, I think everybody's saying, recognizing this, underscoring the second dose is key. People need to return back for their second dose.
Absolutely. Very good point.
And then also, I just had a question, and this is just from some people from my Facebook page, and they wanted me to ask, and definitely this is a discussion with their own physician, but is there any absolute contraindication for getting the vaccine? I know some of the people that had asked me, they had autoimmune disorders, and one had like Stephen Johnson's from an antibiotic. And of course, I'm sitting there, if you have an autoimmune disorder and you need the vaccine to make sure that you don't catch it. But I just wanted to hear your thoughts on when people are asking you these questions about, okay, is there any reason why I should not take this?
So there are two contraindications, which means two groups of folks who should absolutely not receive the vaccine. So that the first is if you had a severe anaphylactic reaction to the first dose. So you got COVID vaccine number 1 and had a really bad reaction. So anaphylaxis is shortness of breath, your blood pressure drops, you can die from anaphylaxis. And the other group is anyone who has had a severe reaction to something called PEG, which is polyethylene glycol, which is in some laxatives and in very, very few medications. So the question that I always get is, if I have lupus, if I have Guillain-Barré, if I've had Bell's palsy, if I have cancer, if I am pregnant, if I've had anaphylaxis to penicillin, if I have a severe bee allergy, can I get the vaccine? And the answer is yes. And if you're really, really concerned, try not to make that decision on your own. See your primary care provider or see an allergist, and they can take you through that process.
Right. And just to the question of, are there any medications that don't interact with the vaccine? None that we can think of. Certainly there's allergies, but there's no medications. If you're on blood pressure medications, diabetes medications, whatever medications you're taking, you can continue them. Even patients who are getting chemotherapy for cancer have been asked to take this vaccine. So please be assured that there isn't medication interactions with this vaccine. There's a great question that I'd like one of you all to target from Judy Uko. She says she received the second dose of, she wants to know if she should get the second dose even after she had really bad headaches after the first, presumably. So should she receive the second dose of the vaccine after the worst 3 headaches that she's ever had? Anyone can take that one.
Yes, please.
Yes.
Resounding yes from all of us.
Yes, and
Yes.
and I think too, maybe the clinician and people watching, I think as sort of, I say this as just in just engaging my aunties, you know, these older Greek women, to please get vaccinated, and I'll help you get your appointment. And it's just they're scared as well. So even though I have a nephew that is kind of working in this space, you know, there's fear, and it's I think it's rational fear, because there's just, we're operating in a sort of historical time of anxiety, and I think what really is important matters is, in addition to the right information and the influencers, you know, you are more likely to get the vaccine when you see your neighbor or your friend. So I think once you get vaccinated, I think it's important to share, and to be honest with, like, if you have, like, you don't feel great and you have a headache, and you know, those side effects, which are typical for any vaccine really, to be, you know, just say people, look, you know, this is likely to happen, and just being honest about that, and really encouraging people to, you know, to take up this vaccine because it will benefit themselves and their community and their loved ones. But yeah.
Because I mean, that 3 days versus the 14 days of headache.
Exactly.
Good points. Very good points. 3 days or honestly, 2 of you raised really good points. One, that we have to be honest about some of the side effects that you might experience immediately after, and recognize too, as per your point, Sonia, that these are mild compared to what you would get if you had the full-blown disease.
Or just like with Amarachi still having the headaches that she's
right, and that back pain that she's talking about, like she has a contraption on her lower back. It sounded horrifying.
One thing I think is really important that I try to tell my patients a lot is, you know, we're getting a lot of questions about medications, reactions, side effects, you know, a lot of fear. And, you know, it's really important for everyone to know that it's normal to be afraid. It is normal to be afraid of medication, just like it's normal to be afraid of surgery, or if it's normal to be afraid of anything that's new, and that may cause you to have some symptoms and side effects. But remember that fear is extremely powerful, and our minds will chew on that fear, and it can paralyze us from making decisions that we know objectively can save our lives. So try to make your decisions with your physicians, with the public health experts on the things that we know. And what we do know is that COVID-19 can be deadly. It can kill you. It can cause long-term, potentially permanent symptoms in patients, and it can affect you in pregnancy. It potentially can affect male fertility. There's so many things we know about COVID, and a lot of the fears around the vaccine are just theoretical that have not been proven.
Mm-hmm.
Absolutely. I think that is a really wonderful point. We can't let fear paralyze us. I'm so thankful for your input, because that was a really great closing statement. Thank all of our guest experts for coming. We really appreciate what you're doing for us here at WDT, our viewers, and in your respective communities. And those of you who have world outreach, we are so honored to have you here and continue to do what you do. I want to bring on all of our, thank you so much for coming, by the way. I want to bring on all of our hosts just to say goodbye and impart any last thoughts. Here we go. So, last thoughts, tips for our viewers. Morgan.
Just the vaccine. It's out there for our to save our lives.
Okay.
Yeah, and I think also from the standpoint, it's okay to recognize our past and our history, but don't let it paralyze us. Let's empower ourselves with that, and let's be part of a discussion. Be part of the process in order to make sure that you are taking care of yourselves. Don't think about the history and deal with it in spite of yourself, in spite of taking care of yourself. You know, move forward with that. Use that to empower yourself in order to help yourself.
Absolutely. I love that.
I just want to say that fear about the vaccine is okay, but being willfully ignorant is not. Talk to whomever you need to talk to, whether it's someone who you know who's gotten vaccinated, your doctor, your religious point person, whoever it is. Just talk. No questions too stupid. Post questions, we'll get to them. I promise you, this is something that's good for our community. And I'm not speaking just African American, I'm talking about humanity.
That's right. I love that. I would like to just say, let's stop talking at each other in general. Not everything has to be a war. Not everything has to be a war. All the wars on social media, all the politicization of a disease that affects everybody, Black, white, red, blue, Muslim, Christian, Hindu, whatever, whoever you are, it can affect you the same way. So let's not talk at each other. Let's talk to each other. Let's be respectful of each other and try and be understanding, have a little bit of grace. In these times, we need that grace because it's a hard time for everybody, no matter where you are, no matter who you are. This is not normal times. This is crazy times. So let's not add to the crazy. Let's be respectful and listen to each other. Let's correct each other, but do it in a way that has some modicum of respect and civility. And be careful what you put in your minds, because there is garbage out there. I'm going to frankly say, even though we can be polite about it, there are things that are frankly and patently false. So make sure that when you're reading something, trying to make a decision about something as life impacting as this, that you're getting it from a source that's respectable and reputable. And lastly, take care of yourselves, protect yourselves, have fun this Super Bowl Sunday, be safe, and we'll see you next time on When Docs Talk. Thanks for joining.